A lot of our older carers, well, first of all, they're over 65, but a lot of them are caring for their partners, their sons, daughters, even a neighbour or a friend who might have all sorts of problems. So it could be anything from a physical disability to a mental health problem, learning disability, and a lot of them are caring despite their own health problems. So there's that additional sort of compounding factor.
My role was to care. I say 24/7, it's not really 24/7, but you've got to be available all the time to help. And that, I think, is quite common with many carers, that there's more to do than appears to be the case to everybody else. You have to drop everything in order to do what needs to be done at that particular time.
Something to note is, obviously, a lot of carers don't see themselves as carers. Many just think they're a good family member or a friend who're just doing their duty, really.
When you care for somebody who can't lift things from the hob to the sink or to the dishwasher, or carry anything because they're on a Zimmer frame, you do all of it. So you are, to a certain extent, you're at their beck and call, which is fine, but it means that it raises difficulties with people who don't want to be in that situation. I'm not talking about the carer, I'm talking about the person who is being cared for. So that creates a level of frustration which doesn't normally come out in the public view, but is the other side, the emotional and mental side of someone who is locked into some unfortunate disease like MS for the rest of their lives.
I'm not a great joiner of organisations, so I tend to be self-sufficient. I try to be, but at that point in my life, with my son's condition, things were very bad and I was getting worse. I went to see the doctor, I was depressed, and he said, okay, he put me on pills, antidepressant pills, and I took them for a week and I felt so sleepy. I thought, well, that's not helping, all that's doing is hiding the situation. And then Kate, I phoned the Civic Centre, then got your telephone number, and we made contact with your organisation.
What we try and do is really try and get them to assess their situation, see how it's really impacting their life, and get them to access as much support as possible in the hopes that we can kind of maintain their quality of life and keep them caring for as long as possible.
This year, just before we made contact with your organisation, it's very bad. We had about 5 different things that were going wrong. John was in a bad phase, very argumentative, very tiring. He actually broke his foot, which meant he was, even on a good day, he was still in his wheelchair. So that meant whenever we went out in the car, it was a major episode. But thankfully, you enabled us, or you got us, his disability permits, which is brilliant. That means we can park in disabled roads now, which really has helped.
A few years ago we applied for disability living allowance. It's now called something different. And although we were very straight about answering the questions, and Anne at that stage my wife Anne was already on a Zimmer frame, we got turned down. So we came to Harrow Carers, and your staff helped enormously to complete the form again a couple of years after the first time, and without being dishonest, by putting the same facts down but making sure we didn't make mistakes that the computer would pick up, successfully put my wife on the highest level of both aspects of mobility allowance.
there's always been a sort of big gap between going into hospital and coming home. Somebody might be sheltered in hospital, and when they come home, perhaps the carer doesn't realise they may have been looking after them before, but they have actually, perhaps their caring role is more needy now. That person is not as able as they used to be, and they may sort of put their own health at risk by doing that. They may need more services, say from social services, and if they need some respite or care, they need to know how to access that, whether social services should be in doing more hours with them, or whether the person they're caring for actually needs to go into a nursing home for a short while for their own sake, or even for the carer's sake, to give them a short holiday or a break away from caring. So we're hoping that maybe it will cut down on some of the admissions, either readmission by the patient or possibly admission by the carer themselves, because they're not looking after themselves properly, because the role is quite heavy.
My wife and I have been able to help other carers in similar positions in this area. So because you, Harrow Carers, knew about somebody who was having particular problems with an MS situation, we got together as your customers and we talked it through, and it wasn't just one way, us helping them who had just been diagnosed with MS and just adopted the caring role, but we actually got the benefit out of it as well by talking together about associated problems. When you asked me if I wanted to come on a computer course, I just retired from teaching computing, so we now share the role of introducing older people to the wonders of computers and the internet, and that's been something which has given me a lot of enjoyment over the last couple of years, and I hope for many years to come.
Most of them have been very positive. They've said they haven't had a lot of help for themselves anyway from the hospital or even from social services. It's somewhere they don't know what's going on out there, they don't know what services are available, and just by having some sort of very unprofessional chat, it's just a chat with people, and they open up, and you often get lots of information from them that they wouldn't talk to a so-called professional about. It's like talking to a friend, and it's a more emotional level I think we're dealing with as well. Sometimes it's just talking to someone, anyone who'll listen and understand what they're going through.